Hello everyone, my name is Michael Brooks, the Vice Chairman of the Sullivan County Legislature. Thank you once again for joining us on this streaming event. We have a lot more questions to answer. The folks are the same. We have one addition. Our Chairman, Rob Doherty, has extended an invitation to paramedic and owner of Mobile Medic EMS, Albie Bachman. And he'll be showing us the vehicle behind me and answering some questions today. Nancy McGraw, our Director of Public Health, is here. Michael Schiff, our County Sheriff, is here. Joshua Potosik, our County Manager, is also here to take questions. First today, we're going to start with our Sheriff, Mike Schiff. He has an important message he wants to convey to the residents of Sullivan County.
Thank you, Mike. I'd just like to read a quick statement that is pertinent to the current crisis. This COVID-19 virus is expected to peak in the next 7 to 21 days. The risk exists that a large portion of our county law enforcement officers may become ill and be unable to report for work. This could leave our communities unprotected. In order to be prepared for this possibility, I am using my emergency powers as sheriff to deputize all municipal police officers in Sullivan County. We have prepared intermunicipal police agreements with the several towns and villages for this purpose. This will enable us to continued response to police resources should this pandemic strike our law enforcement community. Thank you.
Thank you, Sheriff. Our first question today goes to Nancy. Actually, she's going to be fielding a lion's share of the questions today. How many people have been tested? How many people have tested negative? And how many tests are pending?
So good afternoon. We have a current update of 141 positive cases of the people who have been tested, and that brings our total of people being tested to well over 600, going on 500 negatives, which is good news. But we'll continue to update that, I think, once a week, because that information is rapidly changing, and we simply can't provide that on every other day. Unfortunately, there have been 4 deaths as of today as a result of COVID-19, and we want to stress that although we're unable to talk about currently any specifics of the individuals out of respect and privacy for their families, that the current situation in terms of what's happening with the pandemic across the state rings true for Sullivan County. If you're over the age of 60 and you have an underlying health condition, you are at higher risk, and we ask that you stay home and that you limit your contact with other people and all of the social distancing measures that we've been talking about to keep our vulnerable residents safe as possible.
And Nancy, when can everyone, especially seniors, be tested?
So we've gotten a lot of calls regarding the availability of testing, and I'll just remind everybody that this is a statewide issue. Sullivan County is not alone in terms of the availability of limited testing. There are drive-through test sites which are listed on the State Health Department's website. We also have a link to that. And if people qualify, and what I mean by qualify is if they meet certain clinical risk criteria and they're approved by criteria set out by the State Health Department, and they have clinical symptoms, then they can be approved for testing. But there is not a need for everyone to get tested. It's simply a resource issue, and it's clinically it's not helpful just to know whether you're positive or negative at this point, and that's why we're instituting social distancing.
If someone from outside Sullivan County tests positive in Sullivan County, does that count towards the Sullivan County COVID-19 total, or for the county of their primary residence?
Yes, cases are reported by county of residence. So if someone is tested elsewhere in the state, we will get that test result. We may not get it right away. The patient will know possibly before we do at the local health department level, but those cases are counted by county of residence.
Okay, another one for Nancy. How many people are currently hospitalized due to the coronavirus?
At Catskill Regional Medical Center, we currently have 16 patients that are hospitalized for the coronavirus.
On the PowerPoint slide, it says current CRMC bed count. What do the green and red areas mean? How many beds are available at CRMC, including ICU?
So when we talk about surge capacity in our local hospitals, what we're talking about is the ability of a hospital with its current bed capacity in terms of overall beds and ICU beds and medical surgical beds. You know, there's a certain number of beds allocated for different things. And with this COVID-19 pandemic, hospitals all over the nation are planning and doing their surge capacity planning. So currently there's 19 ICU beds at Catskill Regional Medical Center, and as we see the hospitalizations increase, they're planning to add 20 more ICU beds. They have the capacity to do that quickly if needed, in-house, and through other adaptations if needed, they can go up to 99 beds to increase their current capacity. So a lot of planning is ongoing. And that is happening, should it become necessary.
Okay, Nancy, another one for you. How many ventilators are currently on hand, and what are we doing to increase that number?
So some ventilators have been donated very recently, and we're very pleased to see that by SUNY Sullivan and their respiratory program to the hospital. They currently have 21 ventilators on hand. I believe that they had 12 earlier in the week, so they went from 12 to 21. So that's the current capacity right now.
You want to explain the graph too, a little bit with that? Because don't we mention PPE, or is it ventilators?
Well, PPE is separate from ventilators.
Yeah. Okay.
So yeah, we can talk about PPE in a minute.
Okay.
Yep.
Okay, next question. Were there underlying medical conditions regarding the 4 people who unfortunately died from the virus here?
So what I can tell you is it's most likely yes, but I'm not going to go into the details of those 4 individual patients.
Okay, next question. This is for Josh. Is there a plan to protect locals when summer residents return to Sullivan County? There are many older, vulnerable people here, not just seniors. We also have limited resources. It is now April and feel we should be planning ahead for what is to come. Our resources should be used for residents. How is the county prepared to handle travel into our county during this pandemic?
So obviously our public health director, Nancy McGraw, touched on all the planning that's going in with our local hospitals and New York State DOH to anticipate a surge at some point. I think what's important to understand is no one community can kind of really address this by themselves. If you see what's happening in New York City, they're relying on the federal government. And I think what the governor announced yesterday is a great idea, where he's going to kind of, both public and private hospitals are going to be looked at as one big unified hospital system where they're going to share resources, anything from nursing and to supplies, but also moving patients around to where there is capacity and alleviating overcapacity in other areas. So I think that's working with our local hospitals, state DOH, and what the governor announced yesterday I think is going to go a long way to kind of helping us move resources around the state or the region to kind of address bed shortfalls in one area and move them into different areas.
Next question. This is for Nancy. Have we reached out to our summer camp population regarding social distancing protocols and minimizing transmission of the virus? Have any camps or bungalow colonies been closed or not allowed to open?
So we have been in constant contact with our district office, who issues permits for these summer camps, and they are a branch, obviously, of the State Health Department. We've been in constant communication on a weekly basis, every few days, with the State Health Department. Many other counties have these concerns, especially upstate counties, where we have a lot of summer camps of all different types. And we are asking the State Health Department to delay issuing permits to open summer camps at this point because of the current ongoing outbreaks, especially the counties in the Hudson Valley that are seeing an increasing number of cases. Since March 16th, we've gone from 1 to 141 cases. That is really concerning, and we're not the only county in that boat. So we want to do everything we can to limit the strain and the potential for additional strain on our healthcare system. So when we get more information, we will be letting the public know.
Thank you, Nancy. Our next question is a lengthy one, and I'm going to ask L.B. Bachman if he could address this. Do we have the masks and equipment needed? Chinese suppliers are open again and represent that they have anything needed and can ship by express. CPAP machines and also oxygen concentrators can be a great assist for moderate to severe oppressed breathing when respirators are not available. And both CPAP and O2 concentrators are readily available at most medical suppliers.
Hi. First, I would like to thank our county legislature and the county leaders for keeping us updated and including emergency medical services in our town meeting. So that everybody understands what we're talking about, this is the N95 mask. And unfortunately, there are not enough of these to protect your first responders. As you know, the county has received numerous amounts of masks recently. However, we have to distribute them equally as much as we can to all of our healthcare facilities, nursing homes, of which we have 3, Center for Discovery, and many, many other places, the hospital as well. And of course, we know that our hospital personnel go through a lot of them just as well as your first responders. And that's why it's important for us to just let you know that should you need EMS to respond to your home, it is so important that you give accurate information to the 911 center so that they can relay accurate information to the first responders of EMS to take care of you. And especially calling only for acute medical emergencies. Most of the calls that we're getting now are calls for generally ill, and that opens up a Pandora's box, and we have to use our masks. To give you a little idea, picture all of the ambulance services that are responding to the needs of our public. And our paramedic providers are out there, and we're averaging anywhere from 25 to 40 different calls a day, of which we're using these masks. And the masks are getting used, and we cannot replace them fast enough. So make sure that when you do call, it's for emergencies only. But the answer specifically, we do have, but I would say we have maybe a week's supply of them. So it's be very cautious and when you call 911 for an emergency.
Thank you, Ollie. Next question. This kind of dovetails to what Ollie just talked about. Nancy, when will the care center receive more personal protective equipment?
So the Office of Emergency Management continues to get personal protective equipment coming in. We received a shipment last night, and when we put up the dashboard, which we don't have that inside right now, so I have it for you here, you can see that we're monitoring each of these facilities, nursing homes and the hospital, and public health, because we have nurses going out into the field for their PPE stock. We're on daily or every other day phone calls with these facilities, and so if you see yellow, that means that they have about a week or less supply, and they're monitoring their burn rate. If it becomes red or orange, then we know that we're getting in more of a critical zone. But currently, these facilities are in good shape. They've received additional PPE as it comes in. It's distributed back out. And some of the other facilities have been able to get some additional PPE donated to them and on their own. And we also know that SUNY Sullivan and the Center for Discovery are being pretty innovative, as they normally are, with 3D printing and working on some projects to manufacture some face shields. So there's a lot of other things going on out there in addition to our ongoing requests to get PPE. I do want to be realistic that it is in short supply statewide, but we will continue to request what we need.
Next question is for Josh. Which county official is communicating with the governor? That's Josh is asking this question. And how many times a week have we asked for help in getting supplies from Congressman Delgado, Assemblywoman Gunther, and Senator Metzger?
So obviously there's been a lot of great communication between county, local, and state resources. I personally am on a call 7 days a week with the governor's regional representatives, listening to what they are doing at the state level, but also fielding questions from local officials about what the needs are in the local communities. Our state and federal representatives have been great as well. Some of them have visited here and obviously are intimately involved and understand the needs of local communities, law enforcement, healthcare providers, county, municipal governments. And they've been instrumental in trying to get the state and the federal governments to legislate funds, but also resources for our local communities.
Thank you, Josh. Next question I have is for Nancy. Why will Sullivan County not tell us what towns the COVID-19 cases are in, and also the ages of the people and whether they have underlying conditions? We seem to be able to get that information from all of the other areas and counties. Why not Sullivan? We are not asking for identifying information, just town by town numbers.
So as we mentioned, I believe on Monday, when we're ready to release that information, if it serves a useful benefit to the public in terms of information sharing, we will do that. It's not true that all other counties are sharing that information, and they're sharing it, the ones that are sharing it in a manner that is helpful and that people don't make assumptions and that it doesn't risk violating privacy. So we'll continue to have those conversations. And again, I'll underline what we said on Monday in our town hall meeting, and that's, a map can be deceiving. That shows where the people live, necessarily not a dot on the map, but how many people who have tested positive, because they're counted by, they're reported by county of residence. It doesn't tell you anything about where they were exposed. So they could have gone to another county shopping, or maybe they work in another county, but they're a resident of Sullivan County. They're counted as our cases, so that map is deceiving. Although it could be useful in other ways, and we're continuing to look at that, the important message is that we have community-wide transmission of the coronavirus, and that's why we have the statewide important messages on no mass gatherings and staying home. Only essential workers should be out and about, or if you have, just don't go out of your home unless you have to in terms of necessities for shopping and whatnot. So that is the only way we're going to flatten the curve and reduce transmission, and that's really the message we want to continue to get out. So that's where we're at today, and that could change.
Thank you, Nancy. Next question I have would be for Josh. When might our senior centers reopen? This is devastating to seniors that can't congregate and nor are not eligible for Meals on Wheels because they drive. They are not considered high risk. Seniors are out shopping for themselves now, with the exception of the one or two that have family close by.
Yeah, so obviously, as you've heard from federal and state governments, there's no virus that can cure this disease. So the only way to combat this disease is through our behaviors. Obviously, in density, such as a senior center, is places that we're trying to avoid where people are congregating. So obviously, this was a very tough decision the county government had to make to protect our more vulnerable population. And it's advisable, even if you can get out, seniors should remain at home as much as possible. We have resources through our ECAC that we can deliver food. That phone number is 807-0925. So that should be their first avenue to try to, if that's their biggest need is food insecurity, that should be the first call there, and we will be sure we can deliver food to their residents.
Okay, next question for Nancy. There are rumors of customers becoming very threatening and unruly to staff in some local stores when being told there is a purchase limit or items are not in stock. Have there been official reports of this? And is there a limit on how many customers are in a store at a time? And is there any thought to having a police detail or National Guardsmen there?
So, first of all, I want to say, rumors are rumors, and we have had maybe just a couple of phone calls regarding people that were not happy because there were what they perceived to be too many people in a particular store. So we have asked our sheriff's department and our local police department just to kind of keep an eye on things. And if there is a problem, please call them. And I think that, everybody with cooperation doesn't need to get upset with each other or panicky. The important thing is that if you take personal responsibility, if you're out and about, you have to go shopping and get your milk and whatever, that you keep your distance of 6 feet from other people and be respectful. And if you see someone who's not, doing that, then it's important that you know that we are working with store managers and vendors to encourage them to do whatever they can, especially at the cash register, to maybe put a tape on the floor every 6 feet, or to, if it gets to the point where they need to limit the number of people going into the stores at any one particular time, maybe from 2 to 4 or 10 to 12, whatever. Hopefully that does not become necessary, but we're not seeing that on a mass scale. Those are, isolated incidents. And if stores see some obvious instances of hoarding, then, it's upon them really to have a policy in place to prevent that, and maybe to limit the number of items of any one type that someone purchases for themselves, so that there's enough for others. But we're available to take those concerns and questions.
Next question is for Josh. Do you have a tentative date to reopen the government center and businesses in the county?
So obviously a couple things on that. Obviously by having the governor closing basically DMV and moving elections until no sooner than June, it really drove the decision on to close the government center. Two of our more heavily trafficked offices, with a lot of the public coming to the building for those services having been in essence shut down by New York State. Obviously we're going to follow the lead of the governor and what he's recommending, but also the data, right? If we're seeing, and it's 7 to 21 days for us to see a peak, obviously we're probably not going to be opening during that time period if those dates hold true. So no, there's no firm date, but I mean, we're going to follow the lead of New York State, CDC, and also just looking at local data and how much this is being transmitted.
Thank you, Josh. This is for you too, Josh. Will schools reopen on April 15th?
Again, this is something the New York State governor, through executive order, has basically, with every school district across the state, determined he's making those decisions at his level. So while I don't have any firm data, my assumption would be, if you look at, again, the peak dates of between 7 to 21 days, and also the federal government yesterday recommending a shelter in place to the end of April, I would find it unlikely, but again, that's my own personal opinion, and the governor will ultimately make that decision at some point.
Okay, next question I'm going to ask Albie to answer. What is the procedure if you are ill but not with coronavirus?
Should you feel ill and you have certain symptoms, you just may have contracted the classic virus bug, flu bug. And keep in mind also that this is allergy season. And many people may get runny nose, a certain cough, an itchy throat, and we understand that they may be concerned that they have contracted the coronavirus. So before everyone gets overly excited, what we tell you to do is stay home. Stay home. And as you know, there's a direction from the Department of Health as well as an order from our governor to stay home. Contact your local private physician first, and he may guide you. And also you can contact our local Department of Health, Nancy's office as well, and get guidance. So do not get overly excited. And just while we have that corona thing on our mind, just to let you know that should someone contract the coronavirus, that Mobile Medic, in conjunction with our volunteer services of EMS here in the county, have put together the ambulance that you see behind us. And here we protect not only our staff, but we protect the patient as well. So we are educated, we're prepared the best that we can, and just stay home. Thank you.
Thank you. Next question for Josh. What are considered essential services?
Obviously, when you think of essential services, we're talking healthcare, law enforcement, critical government operations, things such as solid waste, our utilities, water, sewer, and essential retail, grocery stores, pharmacies, and the like. So again, I think we touched on Monday. If there's specific questions, the Empire State Development has a pretty comprehensive list of what the New York State has deemed essential, and they have a form you could fill out if you were requesting your business to become essential. So I think the website is esd.ny.gov.
Okay, now before we close out the meeting, we want to call Albie Bachman back, and he is going to give us a little tour of the ambulance behind us. It's impressive what they do, and I'll let Albie take it from here and talk about the vehicle behind me.
Albert, just end it with wash your hands.
As you can see, the ambulance is prepared with very, very thick plastic and is put together here by Velcro. And on the sides you can see the middle is available for our attendant to be able to be seated and also take care of the patient. While they're in here, they are fully taken care of with the protective equipment that you're aware of. You'll notice on the stretcher itself there is a bubble tent of which the patient is placed into. Inside there, they have oxygen therapy that must be on, as well as cardiac monitoring and IV access should they need medications during their illness. We have 3 ambulances that are prepared for this. Hopefully we will never need them. Again, with our volunteer services here in the county, we will be transporting those seriously ill patients from this virus. Again, please, everybody, stay home. Wash your hands constantly, and we'll get through this together. Thank you.
Okay, the county legislators want to thank everyone who has been viewing this streaming event. We're very appreciative. We've been getting good feedback. A lot of questions are being answered here. And in closing, I'd like to share with folks. I was thinking a lot about this last night, and I'm going to mention a couple of my legislators. I hope they don't mind. I don't think they will. But in closing today, I'd like to leave you with some thoughts that are quite personal for some of our legislators. Our current chairman, Rob Doherty, and former chairman, Louis Alvarez, and myself, all have had life-threatening medical procedures and events occur in our lives. To one degree or another, we were close to death, and for some of us, that was close enough to almost touch. In our quiet times, we reflect on what we went through, what it all means, and life seems to take on a different meaning. And each of us realized that we were given a personal reminder on just how fragile life is. A lot of you watching right now can relate to what I'm speaking of because you have been there. COVID-19 is the greatest, largest health threat to our lives and well-being that we have experienced in our lifetime. But the length of stay of this unwanted guest is up to the hosts, all of us. We are in this battle together. Each and everyone's life and good health is so very precious. We as a people are always at our best when we honor our own personal humanity by respecting that of our neighbors. Have a good afternoon. Stay well. Bye for now.